This is Eye on New York for Sunday, August 7th, 2011. Now, from the CBS Broadcast Center in New York City, here is Don Taylor.
And later, we'll talk about a new website that helps you navigate the healthcare industry. It's a consumer cost lookup tool. It could save you a lot of money. Fair Health is a nonprofit organization that was formed to make it easier for consumers to get fair and unbiased healthcare pricing information. Their consumer cost lookup tool is designed to help you save money in a variety of ways, things like comparing doctor's fees for a particular medical or dental procedure when they are out of network, for instance, or you can get the estimated amount an insurance company would reimburse. It can also help you calculate your out-of-pocket expenses. It's very easy, and Robin Gelbert, president of Fair Health, is here to tell us more about it. Welcome. Thanks for coming in.
Oh, it's my pleasure.
You know, it's one of these cliches that's a cliche because it's true, and that is that knowledge is power. And especially when you're looking at, trying to figure out what something costs, especially something as important as healthcare, you need information, and it's so difficult to get that information.
Absolutely. It's amazing that until now this information has not been easily available, something so critical to people's life, particularly when they're concerned about what their health is. You want to take that area of cost off the table as one of concern. You want to pull back sort of the curtain on that information and empower consumers to make informed decisions.
Yeah, we were talking in the break and you compared it to, if you want to buy a TV or something like that, there are tons of places where you can go to get comparisons between brands and competitive pricing as well, but not with your health care.
Absolutely. Until now, consumers really hit a brick wall when trying to learn about healthcare information, and we are so delighted to be able to make this tool available to them.
All right, so specifically, break it down. How does this work? How do you work this thing?
Well, I can give you an example from my own situation because I was able to use the tool in my own life, and this is how others may use it as well. I have a teenage son who will be going to get shoulder surgery who looked at both an in-network and out-of-network surgeon. I had no idea how to compare those prices, so went to the tool to learn in my area where I would be accessing care, what would this procedure cost? What is the estimated charge? I learned what that information was able to compare it to in-network, and then make an informed decision. Before then, I had no information available to me. So now consumers can go based on the area where they will access their care and put in the procedure that they're looking to have done with their zip code and find the estimated charge as well as the estimated level of reimbursement from their insurance company.
Now, does the website have the various insurance companies' data on what they pay, what their payout is, and what the payees have to contribute to that? Is that
well? What we've done to make it easier for consumers is survey the country as well as in New York what are typical plan designs.
Okay.
So what we do is make it easier to default to the most common, but we have some calculators on the tool itself that will allow consumers to adjust it to really specify it to meet their plan needs.
So it's an estimate, but it's an estimate based on some pretty solid information.
Exactly, exactly. That can be adjusted.
Now, do doctors participate? Do they contribute information, or is this based on the best guess of what a typical doctor in this zip code would charge for these procedures?
Well, what makes Fair Health unique is that we are completely independent. So we are working with health plans as well as doctors, and we rely upon doctors because what our database offers to consumers are the actual claims that have been submitted by doctors to the health plans. So we have over 110 million covered lives in our database that we can draw from to give consumers a window into this information.
And are some people using this as a negotiation tool where you can say, okay, you're charging me this, but there's a doctor over, a little ways away who's charging less. Why don't you meet his price?
What we hope is that our information starts a constructive dialogue between the consumer and the physician, as well as the physician and the plans, and the consumer and the plans. All in all of the folks in this particular sphere will have more information to work from.
Now, has the new healthcare laws that are just starting to spin up into motion here, have they helped this situation at all? I know there were elements in there about electronic record keeping, that kind of thing.
I think the new health law helps in that it just heightened people's awareness to the things that are broken in the system and the need for more information that can arm people to make better decisions. So yes, it did put wind at the back of Fair Health.
You said it's nonprofit. How was this service created?
It was created as a result of an investigation brought by then Attorney General Andrew Cuomo in 2009 against many of the major insurers in the healthcare industry.
All right. Ms. Robin Gelbert, thank you so much, President of Fair Health. Appreciate you coming in. Good information. Again, that website is fairhealthconsumer.org.